Welcome my friends, I'm Bob Schrupp, physical therapist. Today we're going to talk about vertigo. I've already showed, or I already had two videos out that showed you the most common treatment you're going to want to do for vertigo. Vertigo is that spinning that you get when you turn your head in a certain direction. And I already talked about how the most common causes of vertigo is BPPV, which is benign paroxysmal positional vertigo. And the most common type of BPPV is the one that involves the canal, the posterior canal in your ear. Now you don't need to know all that, but what happens is when you turn and your symptoms tend to last more than a minute. Now I'm not talking about lasting an hour or two, that's a whole different thing, and that's something you should be checked out by your doctor. But if you turn and your symptoms tend to last more than a minute, the spinning, then you may have a certain type of BPV where you should be doing the liberatory maneuver instead of the Epley maneuver. So this one's going to be for the liberatory maneuver. It's going to be for someone today. I'm going to talk about the person who's having symptoms to the right. When you turn to the right, roll to the right, maybe bend your head over and look to the right. This is the liberatory method that you're going to want to try. So you're going to get yourself onto a good hard surface, probably, well, I guess a bed will work, maybe on the edge of the bed. And again, you need to understand before you start this is what 45 degrees is, because I'm going to be asking you to turn your head 45 degrees. And so first of all, we should make sure that you're not having neck problems so that you can turn your head at least 45 degrees without problems. I don't want to see anybody who has rheumatoid arthritis or severe cervical problems doing this maneuver. So 45 degrees, I'm looking straight ahead, that's 0 degrees. This is 90 degrees, halfway in between is 45. So right now I'm turning 45 degrees to the left, right now I'm turning 45 degrees to the right. So again, this is the left liberatory maneuver for a person who is having, this is the right liberatory maneuver for people who are having symptoms to the right. When you start this maneuver off, what you're going to do is you're going to hold each position for a minute. So I'm going to actually first start by turning my head to the left, and then very rapidly, I'm turning my head 45 degrees to the left. Very rapidly, I'm going down onto my right shoulder and extending my head down about 20 degrees. The shoulder itself will let, if you bring your head down to the bed, it'll make it the 20-degree bend. So I'm 45 degrees, I'm 20 degrees bent down, and I'm going to hold this for a minute. After a minute, I'm going to rapidly go up, keeping my head to the right, and go into this position on this shoulder. Now my head is 45 degrees looking down toward the bed, and I'm going to hold that for a minute. And after a minute, I'm going to go ahead and sit up, slowly bring my head to the middle, and now you're going to follow the same precautions that you would with the Epley maneuver. That is, what we used to teach is that you have to keep your head up for 24 to 48 hours. We used to have people actually wear a soft collar. We don't do that anymore. We do not want you to, however, bring your head down for the rest of the day, so you may have to wear a soft collar as a reminder of that. Or you can even wrap a pillowcase around you, a folded up pillowcase and pin it in place just to remind you not to bend your head down. The other thing I'd like you to do is you're having symptoms to the right, so I want you to avoid laying on your right side for the next 2 nights in bed. And the other thing I'd prefer that you do is maybe sleep with a couple pillows underneath your head. So all those things will help. If you're having symptoms to the left and you think and they're lasting more than a minute, you may want to do the liberatory maneuver to the left. I'm doing that in the next video.